You know, the Constitution is placed above every law whatsoever. And it says that whatever does not tie in with the Constitution is assumed null and void. Now, you've also said that this bill breaches section chapter 4, article 33 on the rights of life of the 1999 Constitution of the Federal Republic of Nigeria.
Yeah, we have to see the new script of the Constitution. You know, they are working on it now. And we have to see the new script and to what extent they have altered those sections. We have to really see it. I can't comment on that now until we see that script and really know what is happening. This is a whole covert action by an international organized crime on Nigeria. And they are fashioning their way into the legislature and capitulating the whole country just because of simple elementary 4 English. And we will not pay attention to it. We must stop this.
But you can comment on the articles 3, 5, 8, and 30 of the Universal Declaration of Human Rights?
Absolutely. It says the right to life.
So
it's paramount.
If the Nigerian legal system or authorities will not listen to you, have you thought about going to the United Nations?
We have written to the General Assembly of the United Nations, and that has been placed before the General Assembly. And we will make sure that this matter not only just to the I'm confident that the Nigerian judges, when they look at this very carefully and see the loopholes in this, they will wipe most of the sections of this law that it will be useless. That is for sure, and we are going to do that. We have already drafted the Catholic lawyers to do the job they need to do in our courts. And we will take this further to the International Criminal Court. That is also on track. So, but we will wait. And we believe, and we are confident, that President Goodluck will never assent to this bill because this will be a national tragedy.
But it looks as though the key concern you have has got to do with human organ trafficking in this, where the consent of the person is not sought here. So if that were addressed, would this bill be okay?
Well, first of all, let me say that is the most important. But if you look at the whole total frame, what will this bill do? You are talking about, if you take this section 1, when it talks about village health practitioners, who is a village health practitioner?
No, but it also talks about all local government health authorities, the World Health Committee, the village health, the private healthcare, traditional healthcare, alternative healthcare.
Have you asked yourself, who is a village health practitioner? We are already dealing with so many people, alternative medicine and all these people called herbalists and all that. And you now have a category you're going to call village health practitioner who will be entitled to receiving remunerations for money for the services they render.
So does that suppose that a village health practitioner cannot be a medical doctor?
That is what it shows, because if it was to be a medical doctor, he could have been under the private healthcare. But he is not. He is a different category. If you take Kenya, for example, where they have this concept and the Kenyans kept quiet and this concept crept into their law of village health practitioner. What are they doing? They would go to the NGOs, would go to the market, pick up some activist women and train them for 2 weeks to do contraception.
What, sorry, I go back to what Njemanze asked about consent, because if people will actually voluntarily donate and also even help to save life, don't you think that this bill should also help in that regard? Because I'm thinking of your argument, because if we go your own way, it just might be difficult for anyone. For instance, if I have to give up an organ of mine to save a life, it doesn't necessarily have to be for monetary gains. With a bill your way, that stops me from doing all of that.
No, even right now, without this bill, you can go, I want to donate an organ to my brother or to my relation. And you can do that, and it's perfectly legal, and under consent, it will be done. You are doing this, and you sign it in your good conscience. You can still do that. So the system now does not need to be fixed in the real sense of it, in terms of there is something broken. This bill does not do any of that. What this bill hands over the biotechnology companies, the ovarian eggs of our Nigerian women, and the whole international organized crime on organ trafficking, it hands them the weapon of the law. They now take it by law.
How rampant is this as a doctor, when we talk about organ transplant in the country, perhaps for monetary reasons? How rampant has this become with or without this bill?
Now, in fact, what this bill spurred up, you must have been hearing baby factories, and not only baby factories, even infants kidnapped from hospitals. What is happening? Are they kidnapping them to give to childless couples? No. They are kidnapping them for organs, which these babies are taken away from Nigeria.
Really?
Yes, that is exactly what is happening. They take them away, take their organs. Those children who are in Western countries, UK, America, and all the Western countries, who are on ventilators, heart-lung machines, if you keep a child on heart-lung machine, almost every week you might spend £100,000. So everybody is interested to get an organ, transplant to this child with a heart defect as soon as possible, and get him off the machine. So it is the Nigerian child who dies in order for somewhere in the world for somebody to live.
Is there any
how can a nation give themselves up to this?
Is there any specific case about this? How do you know that?
Yeah, because, okay, let me just give you the common sense part, because before we start going to the investigations. If you keep somebody to have a child over 9 months, the cost will be about 650,000. And you take care of the person.
A standard health facility? Or?
Well, no, I mean, if you just keep a woman and then feed her and make sure that she gets her medical care, you spend up to 650,000 to do that. These costs were calculated during the Zuma crisis, Dr. Zuma crisis, and that happened in Abia State. So, and Imo also. So that, you will spend up to that. They did sell the children. They say they sell the children for 350,000. How can you do that? You spend 650,000 to sell a child for 350,000. That doesn't happen. No, that's not the reason. The reason is organ export. That is what is happening.
No, but doctor, there are so many people who don't spend 650,000 naira.
Yeah, they will. I mean, there will be people who will spend 200,000. There will be people who will pay 300,000. But let that woman have what we call eclampsia or any of those things. You see, your medical bills will run up.
What about that part where you spoke about the disciplinary facilities? We do have disciplinary measures. We do have the Medical and Dental Council here, and I understand they are back in frame. So if you say this health bill talks about bringing in expertise to come and solve any disputes that arises in any health institution, does it give any role to the Medical and Dental Council?
Well, the disputes we're talking about are like strikes. Doctors, residents, always demand a better condition of
Is it the one you say must be resolved?
Yes, within 14 days. Time? Within 14 days. And if you don't, and this bill empowers the minister to sack everybody, even if it means replacing everybody with expertise from abroad. That empowers him to do that. And you can't do that in a law. In any law. If you go through the paper I gave you, you will see the exact section of it. So you can't do that in any law. So if we continue to do that, what will we have? We will have a situation whereby we can't manage. You know, if you look at section 43, subsection 2E, we can't allow that you fire our doctors, fire our nurses, and what we are going to have here, American surgeons or British surgeons or any surgeons from overseas running beautiful hospitals, which are not for us, but for organ tourism. We can't allow that to happen. No nation can give itself.
I'm just worried about the awareness level on this. Perhaps we should have more people, even other doctors on the other side, to come tell us what they know about this. Because if the pro-life group like yourself, they're the one espousing this, bringing all of this out of this document that may finally be passed or not, well, one worries and wonders if this is just not about you and your group.
No. This is plain, simple English. The laws are written. The amazing thing is the law is supposed to be written in elementary 4 English. And it is written in elementary 4 English. All what I read in section 51, you don't see any donor. You don't see any person, the person who is authorizing is the doctor. It's common sense. Then you say it applies to section 48. Section 48 does not apply to section 52. So you cannot, this is very simple. They can make any cosmetic argument they want. They can make fanciful declarations, as Okowa did in his press briefings. But the reality of the fact is that when we read section by section and see that this is just a bill architected by organ traffickers.
Yeah, but Doctor, I don't see where, I'm looking at the Human Resources for Health,
Yes.
sections 41, 42, 43.
Right.
It talks about development and provision of health resources in the national health system, appropriate distribution of healthcare providers, regulations relating to management of human resources in the health system. I don't see
Continue.
where.
Go ahead. Go ahead.
Up to where? Section
Go to E.
of 43?
43.
Okay, to prescribe strategies for the recruitment and retention of healthcare personnel within the national health system and from anywhere outside Nigeria. But
Good. Good. That's the key word. That's the key word. From anywhere outside Nigeria.
interpretation of this.
Yes.
Okay, you want to go ahead.
That's the
Let me hear
point.
you.
That's the point. When you say that you have the right to do that, and let's say there is a strike at the UNTH, and your determination as the minister says, well, since these people don't want to work and they don't want to accept the condition I've laid down for them, I'm going to employ people from India. That section could be cited, and that's the empowering section.
Even though the entire section did not specifically give that instruction.
It will not give that instruction, but that's the section he will cite as the empowering instruction for him to do that. And that's why we cannot accept this. I mean, well, how will if doctors vote for this and nurses vote for pharmacists and lab scientists vote for this will ruin the health system.
Much as, yes, it does prescribe strategies for the recruitment and retention of healthcare personnel. I mean, one could interpret this and say, well, the intention here is not to terminate people's appointment, because if it were, it would have told
But
you
it could be.
Yeah,
to
but
terminate too.
If it were to terminate, it would have given you the steps and procedure to terminate appointment. But this is only talking about recruitment and retention of healthcare personnel.
Yes.
So
Now,
it's assumed that.
Now, let me give you what that retention can be and recruitment. You have somebody from India. I am going to pay him $3,000. And you have a doctor from Nigeria. I'm going to pay him 200,000 naira. And the doctor from Nigeria said, I'm not going to do this work. I'm going to be doing, in fact, I'm even a better surgeon than this person you got. What do you do? This empowers him to do that.
In isolation of our labor laws?
Even if our labor laws say that this is a law that empowers him within the health sector to make that decision. All what he has to show the labor is that he needs this number of workers to do the job. He's not restricted by the labor laws to say that if he says, I tried to get a Nigerian to fill it, the Nigerian said, I'm not going to do this job. I have prescribed 200,000 for salary. I said, I'm not going to do it. The foreigner is getting $3,000.
Did you say that you set up that some people are working on another draft to see how it should properly be drafted? Did you at any point insinuate that?
No, I didn't say that, because what we had done, we had redrafted this bill in our corrections to them. And this don't seem to accept it. They have been bent on putting the same things, because this whole issue has been driven by the biotech companies. And we have always said that, and we are not making any secret of that. And this is foreign driven, and we can accept it.
Is it about business?
Sorry?
Is it about business?
It's about business. It's organ business. It's organized crime. And, they are going to make billions of dollars in this. The eggs will be used by the biotech companies for embryonic stem cell research. They need 100 million eggs every year to perfect the somatic cell nuclear transfer technique. That's their therapeutic cloning. So they need it from somewhere. And they want to use the Nigerian woman to do that.
Let me just, a few of the benefits in
Right.
this bill.
Okay,
You mentioned a few.
Let's hear it.
Medical care for children under 5 years, pregnant mothers, the elderly above 65, and disabled people, a minimum of 2% of consolidated fund of the Federation for primary health care, a guaranteed basic minimum health package for all Nigerians, unconditional acceptance and treatment of patients with emergency health conditions, confidentiality of medical records, ensured quality of health care services, mark that, ensured through the issuance of certificates of standards. Now, you said there are no benefits.
These are just
no, these are some of the benefits.
No, that is what they are declaring as benefits. But there is no basis. How does this bill do that? That's the question. It's not a question of declaring, oh no, you're going to ensure standards, and the way you're going to ensure standards is to shut down the hospital. That's not standard. So that's what we're saying. They're just declarations.
Okay, well, we'll hope that the appropriate authorities will actually look through all of this, including the concerns that you've raised, alongside any other person who have got concerns, because they think just some clauses need amendment, that some others are not that bad. So we can't throw the entire bill away, we reckon, but who knows, we could be wrong. But I hope they'll just take a look at it and probably do the right things, as it were.
Thank you so much.
But Dr. Philip Njemanze, okay, is the medical director of Global, that's Pro-Life actually.
Pro-Life Alliance.
I don't know why I got Pro-Life.
Pro-Life Alliance.
Thank you for coming on this morning.
Thank you very much for having me.
Okay, then we're back after this. Please join us again.